Obesity is contributing to early puberty in girls. The Journal of Pediatrics reports girls who are clinically overweight begin breast development up to a year earlier than those who are slim. In a study of 1,200 girls, doctors found breast development started, this surprised me, started at about age 8 for girls with the highest body mass indexes versus age 9, which also surprises me, for girls with lower BMIs.
You know, I know I work with young girls sometimes, and I've seen that, and I'm startled when I see it, but now to hear those numbers confirming that's kind of the norm. All right, here to explain the correlation between weight and puberty, Dr. Rosen Crosby from the LA Peer Pediatrics in Beverly Hills. Yep. And, you know, we're shocked, but parents, they must see it every day when they take their kids to school.
I'm not surprised by this study because the first study, which was in 1997, actually revealed this information that obesity was tied to early puberty.
Obesity is growing, right?
But exactly. And so this study is now showing it even a few months earlier than prior studies. So it is getting earlier. And we think maybe because obesity has increased. Why is obesity causing early puberty? And I want to make sure people know that when we're talking about puberty, we're talking specifically about breast development in this study, not when they're getting their period. That actually hasn't gotten earlier. So that's where people are getting confused. It's the breast development.
So is it just a specific hormone to breast development?
Right. And so there's some tie-in with reproductive hormones and weight gain and obesity. Well, one thing is we know that fat cells make estrogen. We don't know if that is 100% the cause of this, but that might be influencing this. So that's part of it. Then there's always other factors. Maybe it's dietary, maybe there's chemicals, maybe
stress, lack of sleep.
Combination of a lot of things could be contributing, but
well, how alarmed should moms and dads be?
Well, I think that if every few years it's getting earlier and earlier, it's a problem. And it's a health problem, too, because if you get it earlier, then you're at higher risk for cancer.
Chronic problems.
Yep. Chronic problems too.
Obesity later in life, all that.
And cancers, breast cancers.
Let's look at a full screen here that has a little bit of a breakdown on some of the problems associated with entering puberty at such an early age.
So one is the higher, so breast cancer, it's definitely been shown that earlier puberty and ovarian cancers too, so other reproductive cancers are higher risk.
Shorter stature, negative influence from older peers, and earlier sexual activity. Why is that?
Is that behavior on the girls' part, or is that because the boys will see them at an earlier age as being sexually identical?
Right, and so these girls, though, physically, they look more mature. Socially, emotionally, they're not ready for the attention they're going to get. There's a higher risk of pregnancy. There's a higher risk of drug use. There's higher risk of depression, actually, in girls. The earlier their puberty is.
And too, as you develop.
Yes. Also, because you get teased.
Yeah, you do.
You do. People look at you and they look down, you know, and that's uncomfortable.
So Dr. Crosby, is this something that we can do something about somewhat quickly by restricting and monitoring diet, or has this been moving generation by generation enough that it's starting to be a little bit inscribed into the DNA?
Right. I don't think it's known, but I think it's more obesity tied, and I bet you we can make changes that would influence it. So that's why we always want to talk about what to do to keep the kids from getting overweight. We're talking about looking at the BMI, the body mass index, and that's what was used in the study, and the percentile body mass index. So
and you say what to parents? And I know, guilty the other day, my niece wanted a soda at the movies, and I'm like, okay, and her mom's like, we don't give her a soda.
Yeah.
So things
think
like
of
that,
all the sugar in that.
Yeah.
And think, you know, we talked about in the past New York City and the banning of the giant sodas. Well, you want to, again, you've got to make sure that the diet is healthy. You've got to limit the sugars, the carbohydrates. They have to exercise, even if it's on the weekend and they have crazy school schedules. Like some have so many things that they get home at 4:30 and then have grueling classes, and it's hard to fit it in.
And then you get child psychologists who say that we're giving kids a bad self-image by telling them they have to diet at an early age. It's such a
but I don't use the D word as diet. So I say we're making changes so that you're healthier too, so that you don't get diabetes and you don't have high blood pressure and you don't have early puberty and you don't get cancers earlier. And so all of these things are so important. And you know, kids will say, I'm hungry, and parents feel guilty saying, you know, no. They're turning down, I want more, I want more. And parents say, it's okay to say no, you know. It's like, I was comparing it to if they love the taste of something like their medicine, like some kids love Tylenol, they love antibiotics, and you can't give them more of that, you say no. Same thing, this is something you're putting in the body that then is becoming not healthy.
Sure.
Yeah, so
Dr. Rosen Crosby from La Peer Pediatrics,
thanks
very much for coming by.
You're welcome.
Wow.